Happy New Year from Reagan Equine Mobile Veterinary Service. This month's newsletter topic is the gastroscopic exam and gastric ulcer syndrome in horses. The stomach of the horse is responsible for breakdown of feedstuffs through the action of enzymes. It is composed of two regions, the glandular and the non-glandular region, which are divided by a ridge called the margo plicatus. The lower glandular portion of the stomach is lined with cells that secrete acids and enzymes. It also secretes buffers and mucus which help protect the mucosal lining. The upper non-glandular portion of the stomach is less protected and more vulnerable to ulcer formation. Most ulcers form along the margo plicatus on the non-glandular stomach wall. There are several factors that can contribute to ulcer formation in the horse. A high concentrate, low roughage diet causes increased acid secretion required to digest grains, while losing the buffering action of saliva that is produced when a horse consumes roughage. A horse allowed to graze all day is less likely to develop ulcers as the stomach is usually always full, whereas a horse that is intermittently fed has periods where the stomach is almost empty, allowing the non-glandular portion of the stomach to contact the acidic secretions. The administration of nonsteroidal anti-inflammatory drugs such as bute or Banamine can reduce the secretion of protective buffers in the stomach. During periods of intense exercise, blood flow to the stomach, which helps to remove acid, decreases, while at the same time increased pressure on the abdomen during exercise can push acidic contents into the sensitive non-glandular portion of the stomach. Other sources of stress, such as trailering and stall confinement, are known causes of ulcer formation. A horse with a stomach ulcer or ulcers can have mild to severe signs that may be chronic or intermittent depending on the cause of the ulcer. Some signs you may see are poor appetite, weight loss, poor performance, loss of condition, lying down more than usual, behavioral changes, and mild or recurrent colic. A diagnosis of equine gastric ulcer syndrome can be made based on history and clinical signs. The only method to confirm the presence of ulcers is by gastroscopic examination of the stomach lining. A gastroscopic exam is an inspection of the stomach lining using an endoscope designed to reach the gastrointestinal tract. To properly visualize the stomach lining, the horse needs to be fasted and adequately sedated for the examination. An endoscope is passed through the nostrils like a nasogastric tube. It is usually 3 meters in length, which allows the veterinarian to examine the esophagus during passage of the scope, all portions of the stomach lining, as well as the upper small intestine. The scope is attached to a monitor which shows the veterinarian a live video of the intestinal tract. In this gastroscopic exam of a healthy horse, we can see a clear division between glandular and non-glandular regions of the stomach, as well as the margo plicatus where ulcers are usually found. Gastric ulcers are graded based on their severity. A grade 1 is an area of reddening or roughening of the stomach lining. A grade 2 is given for small discrete ulcers. A grade 3 can be a large single ulcer or several ulcers. A grade 4 is the merging of small ulcers into a large ulcerated area, and these ulcers are at higher risk for perforation. There are 3 main goals in treating a horse that is diagnosed with gastric ulcers. First is to decrease acid production using histamine blockers like cimetidine and ranitidine, as well as proton pump inhibitors like Gastrogard. We also need to buffer the acid produced using antacids, and finally to protect the lining of the stomach using gastroprotectants like sucralfate. The best way to treat an ulcer is through prevention. Some of the ways to help prevent ulcer formation in your horse may include allowing free choice access to grass or hay, or feeding smaller amounts more frequently. Decreasing the amount of grains in the diet can help reduce the amount of acid produced in the stomach. Horses are also extremely social creatures, and allowing horses to see or touch other horses can help meet their socializing needs. During other stressful events such as trailering, competition, or stall confinement, it can be advantageous to use preventative treatments such as UlcerGuard or Gastrogard. For more information on gastric ulcer syndrome and the gastroscopic exam, please visit our website at www.reaganequine.com. Thank you for joining us today, and we'll see you all next month. Happy trails!